Freddy Castiblanco. Mr. Castiblanco is the owner of Terraza Cafe in Jackson Heights, New York. Mr. Castiblanco employs 6 people in his cafe, and his employees are all uninsured. He's testifying on behalf of the Main Street Alliance, a network of state small business coalitions building a new voice for small business and healthcare. Welcome.
Thank you. Chairwoman Velázquez, Ranking Member Graves, and members of the committee, I thank you for the opportunity to testify on ways to make healthcare reform work for small businesses. My name is Freddy Castiblanco. I'm the owner of Terraza Cafe, small business located in Jackson Heights, Elmhurst neighborhood of Queens, New York, one of the most diverse places in the country. We have been in business for over 8 years. When I immigrated to America nearly a decade ago from Colombia, where I had practiced as a physician, I wanted to achieve the American dream and open a small business. With my own hands and the team of employees, I built a cafe in a formerly abandoned storefront, which has become a vibrant center of neighborhood life, where the community members gather and where local artists show their work. We have built our business to employ 11 dedicated employees, 5 full-time and 7 part-time, and I'm proud to create jobs for my community. As my business grew, I wanted to find health coverage for my employees and their families. However, my hopes were crushed when I consulted a broker and I found the premium for a decent benefits package will be over $700 a month for each employee. This will make healthcare a larger expense for my business after wages. Over 18% of my payroll. That's more than my rent and any other operating expenses. I consider purchasing a less expensive plan, but the high deductible seemed unfair and ultimately worth the cost because my employees wouldn't be able to afford the out-of-pocket costs. I had to make the hard decision to forgo health insurance. I have lost some of my most talented employees because I couldn't provide health insurance for them. I have witnessed employees avoid necessary medical treatment because they fear large hospital bill. What would have been a small problem turned into a large crisis because my workers do not have health coverage. Others have gone without regular checkups and preventative care for many years now and have no regular physicians. It pains me as an employer, as a doctor, that my employees, their families, can't get routine care that would help them live a healthier and more productive life. I share my story because I believe it is emblematic of the larger healthcare crisis, which small businesses have been on the front lines of for years. Our healthcare isn't working for small businesses. To fix this, we must consider the following 4 points: affordable cost, quality coverage, shared commitment, and real choices. I will focus the rest of my comments in the last 2 points: shared commitment and real choice. You may not hear consensus of these points today, but I encourage you to talk to the real business owners in your home districts. You may find they have different views than what you hear from groups based here in Washington. This issue of shared commitment is sometimes put as, do a small business like the idea of mandate? I believe this is asking the wrong question. Nobody likes the word mandate. That's not surprise. But as a small business, do we want good health insurance for our workers? Yes, we do. Do we feel a responsibility to help our employees afford health care? Yes, we do. Do we want to be part of the solution? Yes. Are we willing to contribute? Yes. There seems to be an assumption that if we don't have a mandate, we won't have to pay health care. This ignores the reality that we are paying already. We are all paying the cost of our broken healthcare system in unaffordable premiums for those who have coverage and in losses employees, lower productivity, and financial insecurity for those who don't. As the cafe owner, maybe it's my job to remind us all that there is no free lunch in healthcare. So we are willing to contribute. To make that possible, we need real affordability of real choices. Now, a central question is, should reform include a public health insurance option? I say yes. Let the small business owner decide what works for us, to keep what we have if it's working, or choose something new if we have no good choices, no good options. This will give us greater bargaining power and encourage competition among insurers to make coverage affordable. Some argue we should leave health reform to private insurers, but I ask, why put all your eggs in one basket? It's hard for a small business to trust the insurance companies. Why should we, after so many years of frustration, insurers have been unable or unwilling to contain cost increases and cannot offer a real coverage we can afford? So why put all our eggs in one basket, especially when the basket is broken? In closing, I want to say I admire the American entrepreneurial spirit. I'm proud to be an example of that spirit in action, and I know other immigrants, business owners, share that pride. I know small business will help us regain our economic vitality. We need to fix health care to make this possible. A common sense compromise is within reach give us more choices, including a public health insurance option to ignite competition, drive down costs, and make good coverage affordable. And you will find small business owners on main streets across America not only willing to contribute, but ready to serve. Thank you.
Thank you, Mr. Castiblanco. Our next